In this video, we're going to be looking at the predisposing factors for ectopic pregnancy. But before we proceed, like and subscribe for more videos. Ectopic pregnancy occurs when the fertilized ovum implants outside the uterine cavity, most commonly in the fallopian tube. Predisposing factors are conditions that damage the fallopian tube or interfere with normal transport of the fertilized ovum to the uterus. So you can see an ectopic pregnancy here, which is outside the uterus, and specifically this one is within the fallopian tube. And ectopic pregnancy occurs when there is actually an interference between the fallopian tube and the uterus. It could be due to damage of the fallopian tube or anything obstructing the fallopian tube. Now let's move to the risk factors proper. First is previous tubal damage. Damage to the fallopian tube is the most important risk factor. The causes include pelvic inflammatory disease, tubal infections from gonorrhea or chlamydia. These infections cause scarring and narrowing of the fallopian tube. So you can see a typical fallopian tube here, and you can see an inflamed fallopian tube due to a disease condition or pathology. So next is previous ectopic pregnancy. Women who previously had ectopic pregnancy have a higher chance of having it again. That's a higher chance of recurrence. Next is tubal surgery. Any surgery involving the fallopian tubes can increase risks. Example include tubal ligation, tubal reconstruction, surgery for infertility. Scarring after surgery may block normal embryo movement. So if there is a scarring around this area of the fallopian tube, it obstructs the passage of the fertilized ovum to pass from here into the uterus. So it will likely result into an ectopic pregnancy. Let's move to the next one, which is use of intrauterine contraceptive device, IUCD. Use of IUCD reduces overall pregnancy risk, but if pregnancy occurs, the chances of it being ectopic is higher. So you see this is a IUCD device. So you can see it blocking the fallopian tubes here. So just imagine if there's a fertilized ovum trying to pass here into the uterus, it will likely stop at this level and become an ectopic pregnancy, though chances of pregnancy occurring in the presence of an IUD device is rare. So next is assisted reproductive techniques. Procedures such as in vitro fertilization may increase the risk of ectopic implantation. An in vitro fertilization is done by a physician, so due to some certain limitation it may result into an ectopic pregnancy. Next is endometriosis. Endometriosis is just the presence of endometrial tissue outside the uterus. So you can see endometrial tissue here. So there's always a high chance that if there is endometrial tissue outside the uterus, an implanted a fertilized ovum may end up implanting itself there. So endometriosis in general can distort the fallopian tubes and affect ovum transplant. So endometriosis may occur here and cause a distortion in the uniformity of the fallopian tube. Therefore, the fertilized ovum will be unable to pass from here into the uterine cavity. Next is smoking. Smoking affects tubal motility and ciliary function, therefore increasing risk of an ectopic pregnancy. So some women have abnormal fallopian tube structure, which is known as congenital tubal abnormalities, which may impair transport of the fertilized ovum. So you can see some of the abnormalities here. We have obstructions where you have atresia, phimosis, we have external compression such as ovarian cyst, fibroma, we have total dyskinesia. Mention them. So when each time you think of ectopic pregnancy, the risk factors or the predisposing factors of ectopic pregnancy, you should think of pastes. P is for pelvic inflammatory disease. A is for assisted reproduction. S is for smoking. T is for tubal surgery. I is for IUCD use. E is for endometriosis. And S is for previous ectopic pregnancy. In a nutshell, predisposing factors for ectopic pregnancy include pelvic inflammatory disease, previous ectopic pregnancy, tubal surgery, IUCD use, assisted reproductive techniques, endometriosis, smoking, and congenital tubal abnormalities. Thanks for listening. Do not forget to like and subscribe for more videos. Elite Med Hub, elevate health and mind.